Hey guys, today we're talking about exercise, its benefits, and how exercise can prevent disease. So our objectives are to define exercise, understand the benefits of exercise, and analyze the role of exercise in preventing various diseases. Physical activity and exercise are similar, with physical activity contributing to any type of movement you do throughout the day that increases your health and burns calories. It could be walking up a flight of stairs, or carrying packages from the grocery store to your car, or anything you do as part of your activities of daily living. Exercise is part of physical activity, but it's planned and it's structured and it's repetitive, and it includes activities that will enhance your cardiovascular system through aerobic type exercises, and your muscles through resistance training, and also your body composition by giving you a more favorable body composition by increasing your muscle mass and reducing your fat. It also serves to increase flexibility. Many of exercise programs include stretching, so that helps to increase your flexibility, which helps with preventing injury. So what are some of the risks of being inactive? Inactivity is a risk factor, just as smoking is, or genetics, family history for heart disease, for example. And it also increases our abdominal fat, which is a precursor to developing many diseases, and increases our risks for being overweight and obese, which also is a precursor for many other diseases. In addition, being inactive increases our risk for developing dementia and Alzheimer's. So our brain is greatly affected by being inactive. It also increases our stress, anxiety, and depression, which affects our overall quality of life, as well as increasing our risk for developing certain types of conditions. So let's look at some of the benefits of exercise. So physical benefits, we have improved function in all of our body's organs and systems, which leads to a longer lifespan. Cognitively, we increase our brain activity and we're able to be more focused, we have more clarity, we can make informed decisions easily, we can process information, and we have less of a risk for dementia and Alzheimer's by keeping our brain functioning optimally through exercise. Psychologically, we have improved mood. We don't have those imbalances in moods or those swings that you can get from high to low. We have more of a balance with our emotions and our moods, and we have a reduction in stress. This all helps us with everything else that we're going to do in life. Spiritually, we feel more connected to ourselves. So when we're exercising, we're more in tune with what's going on in our body, what our body needs, and we feel like we're in control. We're taking charge of our life and we're doing something healthy. And in so doing, exercise will prevent many diseases such as heart disease and stroke, high blood pressure and cholesterol, diabetes, obesity, lung disease, osteoporosis, arthritis, cancer, depression, to name a few. So if we look more closely at the physiological benefits that actually improve our performance in life, and also increase our quality and longevity, it really affects every part of the body. With our brain, we have a general feeling of well-being. We can sleep better, aside from the other things we talked about with clarity and focus and preventing Alzheimer's. Having that better sleep is really, really important. It's restorative for all of our cells. It increases our oxygen and nutrients to the brain, which is so important because without oxygen, nothing in the body functions. Our heart or cardiovascular system is improved as our volume of blood increases. The more blood we have to circulate, the more oxygen we bring to all the cells and organs of the body. That's what the cardiovascular system does, delivers the oxygen to every part of the body. So the liver, when we think about, reducing our risk for developing heart disease, the liver is important because the liver, with, one of its jobs is to clear the bad cholesterol out of the body. And it does that by having more of the good cholesterol. So we know that exercise increases our good cholesterol, lowers our bad cholesterol, and gets rid of, decreases our triglycerides. This makes the liver function much, much better in being able to clear out the bad cholesterol out of the body. So exercise really improves the function of the liver in that regard. With regard to the pancreas, it helps to regulate our blood sugar, so we don't have these swings in insulin levels and blood sugar that stays in the sugar or glucose that stays in the blood. Rather, with a proper functioning pancreas, we can, get the sugar out of the blood and it'll be absorbed by the cells, and therefore our blood sugar won't increase and we won't develop diabetes. Our muscles are enhanced. We increase our muscle mass, which means our body composition is better as we have more mass and then we do fat. And that helps with giving us strength and endurance, which helps in everything we do. We're more agile, we have more balance, we're less prone to falling. Thyroid is increased with regard to metabolism, so that helps with weight control or weight loss. Our lungs capacity is greater, so we could take in more oxygen, breathe deeper, and be able to deliver more oxygen throughout the body. Our digestive system is working better, so we have less issues with irritable bowel or heartburn and indigestion. Our joints are stronger, so we have less issues with arthritis, and even if we do have arthritis, there are a lot of exercises that can help it. And our bones are stronger, so we can avoid developing osteoporosis. So the major diseases that we're looking at in preventing via exercise are cardiovascular disease, type 2 diabetes, obesity, hypertension and hyperlipidemia, cancer, and osteoporosis. Cardiovascular diseases includes anything having to do with the heart and the vessels in the body. So it has to do with stroke, heart disease. Type 2 diabetes is something that usually is developed later on in life. It used to be called adult onset diabetes, but we're finding it more and more in children. So type 2 diabetes can affect young and old. It can be genetic, and it is tied into lifestyle choices with regard to diet and exercise. Obesity is a precursor for many other diseases, so we want to prevent that, and exercise is a great way to do it. Hypertension or high blood pressure and hyperlipidemia or high cholesterol contribute to heart disease. So with exercise, we can lower blood pressure and cholesterol. With regard to cancer, there are so many cancers, and not every cancer has been tested fully with regard to the effects of exercise. But there are some that have been tested more than others, and we'll review that in a couple of seconds. With regard to osteoporosis, we can prevent that disease because the more we exercise, we're building bone density. So if we look at heart disease is the #1 cause of death for men and women in this country. And what we know about exercise is continual exercise can reduce that risk by 50% because it reduces the bad cholesterol and triglycerides, and it increases the good cholesterol, which the good cholesterol, the more you have, the more it will get rid of the bad cholesterol. So, exercise helps in making a more favorable, makes the heart more efficient and functioning better. It's more favorable. And it reduces your risk of developing stroke and also reduces your blood pressure. Diabetes, 170 million people are affected by this disease. That's a lot. And it can be prevented through regular exercise and eating properly. And we know that exercise helps to regulate glucose or sugar in the body as well as insulin. And by keeping everything balanced and keeping the sugar out of the blood and into the cells helps to prevent developing diabetes. One thing we know is that even if you do develop type 2 diabetes, through a very good nutrition plan and regular exercise, you can decrease and even reverse the disease. With regard to cancer, colon cancer, men and women both have a 30 to 40% decreased risk of developing it if they exercise. And with regard to breast cancer, women have a 20 to 40% decreased risk in developing breast cancer through regular exercise. What we do know is whatever type of cancer that you do have, if you develop it and you begin exercising properly, it can prevent a recurrence if you're in remission. And regardless of your cancer or what stage you're at, if you are exercising, whatever treatment that you're receiving, the symptoms are lessened by exercise. So it's easier to get through the whole treatment of the disease. Osteoporosis affects a lot of people, and sometimes it's genetics and sometimes it has to do with your lifestyle choices. But one thing we know is that exercise can help prevent it. As long as you're doing weight-bearing aerobic type exercises, whether it's jumping or running or walking really quickly. Resistance training, using weights or your own body weight is important in putting force on the bones that helps them to regenerate. So bone is living tissue, and when we exercise, we put stress on that bone that causes it to generate new cells. And so doing moves like squats and lunges or any kind of combination move that uses a lot of different muscle groups in the body is another way to help build your bone density. So the more bone growth you have and the more density the bones, the less your risk for developing osteoporosis. Obesity, a lot of people don't look at it as a disease, but it is. It is now classified as a disease because 67% of the population is either overweight or obese. The problem is obesity raises your risk so much for any type of cardiovascular diseases, heart disease, stroke, high blood pressure, and it also raises your risk for diabetes, osteoporosis, arthritis, sleep apnea, and even cancer. And sleep apnea is something that many obese people are affected by, and they go to sleep at night and all of a sudden stop breathing. So they have to wear a mask where they're breathing, and the machine has an alarm that sounds if they stop breathing, wakes them up. It's a horrible thing because if they're not getting enough oxygen, the cells are not repairing properly. And when we sleep, we need a good 7 to 8 hours of sleep to help the cells restore and revitalize and regenerate. It keeps us healthier. Not enough sleep is a problem with regard to health. And sleep apnea causes interruptions in sleep and less oxygen to get to the body. Less oxygen, the less repair that's going on. So when you want to sleep well and you want to get that restorative sleep, you want to make sure that you're getting a good 7 to 8 hours of uninterrupted sleep so that you're getting enough oxygen to all the cells so everything can regenerate while you're sleeping. The way we can reduce obesity is obviously through calorie reduction, but we also want to increase our weight training because resistance training helps to increase our metabolism and helps us burn calories at a faster rate. And endurance exercises, we've got to do some type of aerobic activity for 60 to 90 minutes a session. But if you think about a person who's obese and you think how they have so much to lose with regard to weight, if they just lose 5 to 7% of their body weight, they will reduce their risk of disease by 58%. So in summary, 1 in 5 or 21% of the US population exercises regularly. That's really small considering how much we all know about exercise and how beneficial it is. For the general healthy population, follow the American College of Sports Medicine's guidelines for exercise. It will help you design a program with regard to what type of exercise, how hard or the intensity that you should be working at, how many days per week for aerobic exercises versus resistance training, how much flexibility should I be doing, etc., how many minutes per session. So there are really good guidelines for you to help you design your own program. And if you visit the American College of Sports Medicine's website, www.acsm.org, you'll get a lot of that information. And if you're still confused, consult a fitness professional to assist you in designing a program. If you're a special population, meaning you have a certain medical condition or diseases or physical limitations, you should not be doing anything on your own. You should be obtaining physician approval before starting any exercise program and consulting a clinical exercise physiologist. This is a person that has multiple degrees and certifications in the field with a clinical and medical background that is able to understand the medical conditions you have, the types of medications you're taking, and how that's all affected by exercise. So if you want more information, I've included a link here for the CDC, or the Centers for Disease Control and Prevention. They have a great website with regard to information on physical activity, certain statistics, how you can get more physical activity into your life, etc. But remember, like anything else, exercise needs to be part of your day. It needs to be planned. If it was planned, then we'd have more than 21% of the population doing it regularly. I'm sure more than 21% of the population go to work every day or shower every day, etc. So if you want exercise to be part of your lifestyle, you need to plan it as part of your daily activity. So I hope this was helpful, and keep checking back for more presentations on all areas of health and wellness and helping you find that best version of you.